Do you ever feel like your eczema isn't really eczema anymore and that no one understands how to help your skin condition? Well, sadly, I've heard this before, and this video is probably for you and maybe what you've been looking for. Hi, my name's Dr. Eve, and I want to talk to you today about something that you may have heard about before. Hi, it's Dr. Eve, and I want to welcome you back to my channel, to Dr. Eve's Skin. Today we're going to be talking about a topic that you may have heard about before and that many of you have requested: topical steroid withdrawal, or known as TSW to many in the community. In the medical community, this is a topic that is still being debated and a diagnosis that has actually been recognised by various medical bodies, including the MHRA, the British Association of Dermatology, and other bodies in the US and Australia, to name a few. But unfortunately, because it's still emerging as a recognised pathology, it has been reported to only be rare. Or is it? Let's dive into the topic today. TSW, or topical steroid withdrawal, is a condition that affects people who've used topical steroids for skin conditions such as eczema or psoriasis for very prolonged periods of time. And usually this means years. And it can be quite challenging to understand and also to treat. My hope is that by the end of this video, you'll have a clear understanding of what TSW is and how it can impact your life or the lives of those you love, and hopefully how we can treat them. Firstly, topical steroids are commonly prescribed for various skin conditions. As previously described, conditions like eczema or psoriasis or even other skin complaints are usually used for managing these skin conditions. And their role is to reduce inflammation and to control the symptoms associated with it, like itching. And while they can be very highly effective when used as prescribed, many people end up using them for indiscriminate periods, longer than the period of time that they were normally supposed to use it, and traditionally uncontrolled use and unregulated use can lead to further side effects associated with steroid use. And in many cases, unfortunately, some clinicians advise patients to use it without further review. So this is why we've ended up in this position of topical steroid withdrawal. So let's talk about what is TSW. Topical steroid withdrawal, or TSW, is a condition which is known to occur in a person who has been using topical steroids for an extended period of time and then suddenly stops using them, and then the body goes into a state of withdrawal. It's often known as red skin syndrome, and this is a term that some people like to use. And this is because of the prominent symptoms that can be experienced, such as intense redness of the skin and discomfort. TSW can affect anyone, regardless of your age or your skin type or your skin colour. So this means that some people who have TSW and are affected may not actually look red. So that's something to always be considered. TSW symptoms can vary from person to person, but for some, the most common symptoms are these, and they include redness and inflammation of the skin, where the skin becomes intensely red as if they were on fire, and they may appear swollen and irritated as a result of this. A second symptom which most people complain of is itching. Again, this can be very intense and unbearable for patients, and as a result of trying to relieve their itch, they often lead to further skin damage as the person seeks relief. Burning and stinging of the skin is also a feature of TSW, and many people will describe altered sensation of their skin and feelings like their skin is on fire, or others might describe a sensation of tingling on the skin because the skin is not functioning well. We'll go into this later. A fourth symptom that some people might experience is flaking and shedding of the skin. This is a common symptom, and the skin may start to peel and shed as if it was a snake, and the skin may appear to look very different and bear no resemblance to the original condition that they were being treated for example, eczema. So they may now appear to have complete redness and scaling and peeling of their skin all over. Another symptom of this condition is oozing and crusting, and this is a very typical feature of TSW and can be experienced by some individuals who have the withdrawal effects of steroids. And finally, one recognized symptom that we do know about with regards to steroid use is thinning of the skin, which occurs over time as the skin becomes thinner and more fragile. TSW occurs because the body becomes dependent on the steroids to manage the skin issues. Tolerance often results from use of steroids, and the patient often needs more steroid to get the same effect, so often require more and more potent steroids. Often starting on the minor steroids, they end up needing most of the more potent steroids. Unfortunately, after using this for long periods of time and suddenly stopping them, the body is unable to regulate inflammation on its own, leading to much more severe symptoms as the steroid is withdrawn from the body. The important thing to say is that this phenomenon does not routinely happen to anyone that uses steroids. It is not a situation that most people will encounter, and especially those who have minimal, limited use for short bursts as per recommendation by their doctor, they will likely not ever experience the side effects of topical steroid withdrawal that we're talking about in this video. So I really want to reassure you, steroids are not an enemy. They can be used very effectively if they are used properly, and regulation of their use is a key part of this. TSW is often diagnosed on the basis of a patient's history of prolonged topical steroid use over many years, and this is usually mentioned with characteristic symptoms as previously described. And currently, there is no formal recognized diagnostic or scoring criteria, but a good history from a dermatologist or skin doctor experienced with TSW may be able to help you make the diagnosis after detailed consultation and examination of your skin. Unfortunately, there is no one-size-fits-all treatment pathway for management of TSW, and this is mainly dependent on the person that's sitting in front of you as a clinician. The primary medical approach is to gradually discontinue the use of topical steroids under the guidance and the management of a healthcare professional trained to manage TSW, using alternative treatments which do not involve steroids to help manage your symptoms and help your system withdraw, or your body withdraw, from steroids. You may be recommended a combination of things like moisturizers, gentle skincare routines, and other non-steroid based medications to manage the symptoms associated with TSW as the skin wins off the steroids. Remember, it is important and essential to consult with a medical professional who understands TSW for personalized advice on how to manage your symptoms. Unfortunately, remember, there is no one-size-fits-all method for doing this. Thank you so much for listening to me today. Topical steroids can be a tough journey, but with the right care and support, many people do recover. Remember, every journey is unique and different, and the time it takes for one person to recover versus another person may be different for your skin in comparison to another. So do be kind to your skin. If you do suspect that someone you know is experiencing TSW, it's essential to contact a medical professional like a dermatologist or a skin doctor with knowledge of TSW who can help guide you in the management of TSW. Thank you so much for joining with me today to learn about TSW. I hope this video has helped you to better understand the condition and to realize there is hope for you. If you have any questions or you want to know more about TSW or you want to share your TSW journey, please feel free to comment down below, and don't forget to like and subscribe. Remember, be kind to yourself and to your skin. Thanks for watching.